Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Movement disorders, and you're looking at the site of the lesion. So the first one is we are discussing about the athetosis. So the athetosis. So as far as athetosis is concerned, the lesion, it lies in the globus pallidus. So globus pallidus is where the lesion is present. Next one will be the chorea. So in terms of chorea, the site of lesion will be the putamen as a caudate. So it is nothing but the putamen as well as the caudate. Next is we look at the hemibalismus. So hemibalismus. So here in terms of hemibalismus, it will be the subthalamic nucleus. So it is a subthalamic nucleus. And when you look at Parkinsonism, what is it? So in terms of Parkinsonism, it is nothing but the SN. SN means the substantia nigra. So to recap, the first one, there is a movement disorder site lesions. There is the athetosis. Athetosis is concerned with the globus pallidus. Next comes the chorea. The chorea is the site of lesion is the putamen as well as the caudate. Next is the hemibalismus. So in terms of hemibalismus, there is a subthalamic nucleus. Then comes the presence of the Parkinsonism. The Parkinsonism will be the SN, that is a substantia nigra. To learn and grow daily like this, please do subscribe.